Do you feel bloated, full of fluid? Are you suffering from edema associated with CHF, psoriasis of the liver, renal disease, nephrotic syndrome, mild to severe hypertension in combination with antihypertensive medications, or pulmonary edema? Hi, I'm Justin Nunez, and I have the drug for you, furosemide, also known as Lasix, which is classified as a loop diuretic. It stimulates the kidneys to remove the water from the body by acting on the loop of Henle in the nephron of the kidney, which is where loop diuretic comes from. Furosemide is used to decrease the amount of water in the body. This is beneficial to patients with CHF, pulmonary edema, psoriasis of the liver, and the other signs and symptoms I previously stated. But the main indications are edema and resistant hypertension. To understand loop diuretics, we need to understand the basics of the kidney. The kidney is made up of about 1 million nephrons, and these nephrons are responsible for filtering and balancing fluid and electrolytes between the blood and the urine. Water and small molecules are filtered from the blood in the glomerulus, thus producing the filtrate that contains the varying amounts of water and small molecules that are reabsorbed from the filtrate to the blood through the tubules and then through the loop of Henle and ending in the collecting ducts, which leaves the end product, urine. The loop of Henle is a key part of loop diuretics because it is responsible for the water balance between the blood and urine, where large amounts of sodium and water are filtered into the blood from the filtrate. In the descending loop, the cell walls are permeable, allowing water and sodium to filter out of the filtrate into the interstitial fluid. In the ascending loop of Henle, the walls are made of columnar epithelial cells. These cells are tightly packed, making them impermeable to water. These cells have a co-transported molecule on the luminal side of the loop. This active transport system moves sodium, potassium, and 2 chloride molecules out of the filtrate and into the interstitial fluid. Through these actions, it lowers the concentration of the filtrate inside of the loop as it loses sodium, potassium, chloride, and water, which leaves the filtrate to become the final product, urine, in the collecting ducts. Loop diuretics work by blocking the function of the membrane co-transporter protein in the ascending loop. Thus, it prevents the sodium, potassium, and chloride from entering the interstitial fluid, which will eventually get those molecules into the blood. Now, for the type of patients we wouldn't want to give this to, are patients with a hypersensitivity to furosemide and sulfonamides. Precautions for this drug would be for patients with systemic lupus erythematosus, liver disease, and renal impairment. Side effects for furosemide include anemia, anorexia, diarrhea, dizziness, glucose intolerance, glucoseuria, headache, hearing impairment, hyperuricemia, hypocalcemia, hypokalemia, hypomagnesia, hypotension, increased patent ductus arteriosus during neonatal period, also cramps, nausea, photosensitivity, rash, restlessness, tinnitus, urinary frequency, urticaria, vertigo, and weakness. So if you want to go back out into the world and enjoy your life, talk to your doctor about if furosemide is right for you. Bada bing, bada boom.